Hello, my name is Brian Wadsworth, and I'll be talking to you about my poster, Capacity versus Performance, Maximizing Patients Carryover from Therapy to Life. To begin with, I want to define both capacity and performance. Use of outcome measures is standard practice in neurorehabilitation, and this is a means of objectively quantifying a patient's functional capacity. However, performance refers to a patient's ability to engage in their environment. This is often overlooked in clinical practice, and part of that may result from the challenges that exist in monitoring this aspect of our patients' rehab. Evidence suggests that there are meaningful differences in self-reported mobility as compared to objectively tracked stepping in patients. Therefore, it's important to identify accurate and meaningful ways to objectively gather this data to empower therapists to understand the impact of their interventions on their patients' daily lives. Utilizing wearable devices can support this aim. Ultimately, the purpose of this within-subject comparison case study was to assess the influence of patient education involving objective step monitoring as compared to education that does not make use of this technology in an effort to determine how this may influence a patient's community-level performance. The patient in this case study was a 62-year-old male who had suffered a stroke a year and a half prior to working with me. Step monitoring was tracked via his smartphone. For intervention, this patient participated in high-intensity gait training as defined by the locomotor CPG for 20 visits. In the first 10 visits, the patient was educated to perform 30 minutes of walking per day with an emphasis on increasing his breath rate while still being able to hold a conversation. In the second 10 visits, the patient was educated to try to walk a minimum of 10,000 steps per day, to check his daily step totals at the end of each day, and then I would be checking his daily stepping once per week to monitor his progress. What you can see in the figure is a graphic demonstration of the patient's stepping as a change over the course of my time working with him. What is readily apparent in this image is that in the first 10 visits, there's minimal change in his actual daily stepping. However, in the second 10 visits, when the emphasis is placed on objective step tracking, there's a large improvement in observed average daily stepping. If you look at the results, you can see the very large improvements in his 6-minute walk, gait speed, balance, and 5-time sit to stand following the first 10 visits. These assessments indicated that the patient had made clinically meaningful improvements in his capacity. However, despite this improvement in capacity, you do not see similar improvements in his performance. It's not until the second 10 visits, while he's receiving more objective step monitoring and education, that you see a large improvement in his average daily stepping. Evidence in this case study suggests that simply promoting clinically quantified improvements in patient capacity does not necessarily translate to improvements in community-level performance. This is an essential takeaway because as we become more consistent in applying outcome measures within our clinical practice, we must also remember that it is just as important that we simultaneously assess our patients' performance. To do this, we should make use of wearable devices which can objectively provide stepping data. By simultaneously focusing on our patients' capacity and performance, we may enhance our clinical practice and our patients' resulting quality of life. Thank you very much for your time. I look forward to presenting this poster at CSM 2022 and would be happy to discuss further with anyone who is interested.